Hello and welcome to today's webinar on what is therapy and when do you need it. My name is Marnie Merrilees. I'm a sport and exercise psychologist and a counsellor at Thrive. I have considerable experience in mental health as a psychologist for the NHS within sport and exercise psychology and counselling, and I will share some of my knowledge and experience with you here today. Firstly, we'll be discussing what therapy is, as well as providing some information on what to expect from therapy. If you have any questions, please pop them in the chat and we will pick them up towards the end of the webinar, when we will have around 10 minutes for questions. After we've taken some time for questions today, Zoe is here from our relationship management team to talk to you about how you can access the Thrive therapy service via the app. So let's just take a moment to think about what we think of when we think about counselling. So what is your understanding of counselling? You can share some of your thoughts in the chat. So for example, if you look at the picture, which one of those do you think might be the client and which one might be the therapist? Or people are saying the chat seems to be disabled. We can use the, thank you for letting me know that. We can use the question and answer function if that's okay. Yeah, so people have said that the client is the one talking and the other one is the one with the arms folded is a therapist. And then someone else has put, the woman is the therapist. And then someone's put, you can't tell who the counsellor is. Some more people have said the person talking is the client. And then someone's asked, just checking that I can hear you, or is it just through here? For the time being, we're just using the Q&A function to interact with each other. Towards the end of the session, when we come to the question and answers time, you can unmute then if you want to. Yeah, so there's plenty of people got some thoughts on which is the counsellor and the therapist. What about if you look at their body language? Yeah, as someone said, the woman has her arms folded, so she looks defensive and looks like the client. And someone else put the lady is the client and she looks closed off, which I would tend to agree, because in counselling, body language and developing rapport is really important. Now, if I was a client and I went to see a counsellor and they sat with their legs crossed and their arms folded, I think they were sort of very closed off and defensive, and it would make me feel uncomfortable. So as a counsellor, it's very important to have an open body language where your arms aren't folded, they're just open, your legs aren't crossed. So you're inviting a conversation. So be proactive, not reactive. Today, I'm going to ask you all to start being proactive rather than being reactive with your mental health and well-being. It's better to seek support when you first notice you may be experiencing some psychological distress for whatever the reason, so that these feelings, emotions, or behaviours can be explored and reflected on in a healthy way, in a safe space within the therapeutic relationship, so that you are being proactive in looking after your mental health and well-being, rather than being reactive and only seeking support when you are experiencing severe psychological distress, or are in crisis, or when your quality of life has been significantly impacted as a result. The sooner you seek help, the sooner you can improve, and the less likely you are to continue on a downward spiral. Like most problems, they don't go away on their own, and certainly not by burying your head in the sand. And the longer you leave them, the worse they get. And the result is that they can then take twice as long to resolve, compared to if you nip them in the bud and take appropriate steps in the first place. So the key here today is to be proactive in your mental health and well-being, rather than reactive. Today, we will cover the following topics. We will look at what is counselling, why do we need therapy, signposting to professionals, followed by 10 minutes question and answer, where you can unmute yourself if you like at that point. And finally, a Thrive Therapy demo delivered by Zoe Alcott-Wells. Throughout today's webinar, I may use the terms therapy and counselling interchangeably. And you may have heard people talk about psychotherapy, psychological therapy, and talking therapies. Usually there's very little difference between what's meant by these terms. They all broadly refer to talking therapy, as opposed to other types of treatment, such as drug therapy. But they might indicate differences in the type of talking therapy available. So what is counselling? Talking therapies are treatments which involve talking to a trained professional about your thoughts, feelings, and behaviour. There are many types of talking therapy, but they all aim to give you a safe time and place to talk to someone who won't judge you, to help you make sense of things and understand yourself better, to help you resolve complicated feelings or find ways to live with them, and to help you recognise unhelpful patterns in the way you think or act and find ways to change them if you want to. So why do we need therapy? Therapy can help you manage and cope with a range of problems or issues, such as difficult life events, bereavement or losing your job, relationship problems, upsetting or traumatic experiences, whether it's something recent or something that happened long ago, difficult emotions such as grief, guilt, sadness, confusion, anger, and low self-esteem. Depression and anxiety are very common, and other mental health problems, and long-term physical health problems. Talking therapies can differ in their focus. For example, learning more yourself by talking about your past, or working on overcoming a specific problem you have now. Also, the techniques the therapist might use during sessions, and the academic theory behind them. Many therapists are trained in several different styles and will tailor their approach for you. In this case, they might also use words like eclectic, blended, integrative when they describe how they work. Some of the common types of therapy are psychodynamic, which explores how your unconscious thoughts might affect the way you act. Cognitive explores your thoughts and the way you think, such as cognitive behavioral therapy, or CBT for short. Person-centered focuses on using your own strengths and insight about yourself to encourage personal growth and improve relationships. Humanistic focuses on the individual as a whole, including the mind, body, spirit, and soul. Solution-focused focuses on what you want to achieve in the future, rather than exploring the past experiences. And mindfulness involves becoming aware of your current thoughts and feelings and accepting them. Mindfulness techniques include meditation and breathing exercises. Preparing for therapy. At this initial stage, it's important to mention any special requirements or preferences you may have. For example, if you'd feel more comfortable seeing a therapist of a particular gender, or who speaks your first language, or has a particular specialism. If you have therapy face-to-face, these are some common things you could do to make the sessions feel more comfortable. For example, to make the room feel more safe and comfortable, you could ask to change where you sit or adjust the lighting in the room or the temperature so that you feel more comfortable, and then you'll feel more relaxed. Nowadays, many of us have remote therapy, such as over the phone or over the internet. For example, via a chat-based function or video call, such as Zoom or Google Meet, rather than the face-to-face interaction. Initially, you may worry that it will be harder to have an open and honest conversation. However, let me reassure you that this is not the case. Once you get used to remote sessions and you develop rapport and a therapeutic relationship with your counsellor, these are some tips to help make your sessions feel more comfortable. For example, try to find a place in your home where you won't be disturbed. So if you're worried about being heard by people who live with you, you could try using headphones, for example, or go somewhere more private, such as in your car, or go for a walk. Individual therapy is one-on-one counselling with a therapist, whereas group therapy is more than one person with a therapist. One-to-one sessions typically last between 50 minutes to an hour, but group sessions can sometimes be longer. It's common for sessions to be held once a week, but you might also agree to see your therapist more or less often than this. How sessions are structured can vary depending on the type of therapy you're getting and the type of problem you want help with. Therapy can be time limited, meaning your therapy will come to an end after a set number of sessions. Most therapists through the NHS offer time-limited sessions, or open-ended, meaning it can continue for as long as you need it. The working alliance. The quality of the therapeutic relationship or working alliance has been demonstrated to be especially important in predicting the outcome of therapy. The working alliance has been defined as the extent to which a patient and therapist work collaboratively and purposefully and connect emotionally. Your therapist might describe themselves in various ways, such as a counsellor, a wellbeing practitioner, a therapist or psychotherapist, a psychologist or a clinical psychologist, or a psychiatrist. All of these titles mean that the person you see is trained in delivering therapy, although they will differ in their educational background and level of training. But whatever their title and level of training, it matters that the person delivering your therapy is someone you feel comfortable talking to. The relationship you have with your therapist is really important in how successful you find any talking therapy. Regardless of the type of therapy they practice, if you don't like or trust that person, you're less likely to feel able to open up to them and are less likely to have a positive experience. So what to expect in your first therapy session? It's good practice for any therapist to be a registered member of one of the professional bodies. This means they've signed up to meet certain standards of practice. You can ask your therapist about their professional qualifications, training, and membership body. And you can usually double check this through the membership body website. For example, when I'm meeting a client for the first time, initially I will focus on the introductions and developing a rapport with my client. We will then work through the therapeutic contract, which I call housekeeping. It is here where we explain the limits of confidentiality, such as if the client was found to be a danger to self or others, a victim or perpetrator of abuse of children or the elderly, or if a court ordered the release of the information. Otherwise, all information shared in the session will be between the athlete and the practitioner, or the client and the counsellor, unless otherwise stated. I always inform my client that I have a supervisor, and it may be in the interests of my client to discuss details of the case with my supervisor. But I also reassure my client that my supervisor also works within an ethical framework and that anything discussed would be confidential. If, for example, instances were to arise where a manager or coach, for example, requested information or the client agreed for me to share information, written consent would be required. And any wording or progress reports would be agreed with the client or the athlete before passing on to the manager or coach. I would also then inform my client about data protection and record keeping. So, for example, anonymity. So any records kept are password protected and secure on a computer, or any paper documents that are kept, it's just the initials on the forms. Boundaries will be agreed in the initial contract also. So, for example, what do we mean by boundaries? Things like number and duration of sessions. So, for example, there will be up to 12 sessions in total, lasting 1 hour. And the second session, ideally, would be no more than a week from the first session. At this point, I would also inform the client of any holidays that I had booked or time off. And I would also check to see if they had any holidays booked or couldn't attend some sessions, and write the date in the contract to allow for these. And then sessions would be arranged at suitable times for the client and myself. Within the boundaries, there's a cancellation policy that states 24 hours notice is required, but this varies depending on the service that you go to. Often it is just good practice and polite to let the counsellor know if you're unable to attend a session. And likewise, if the counsellor is unable to attend a session, the sooner you let the client know, the better. Often in sessions as well, as part of the boundaries, I will inform the client that they'll be required to carry out homework tasks. Often people haven't done homework since they're at school. So when I talk about homework, I say, for example, keeping a log of your thoughts and feelings. Because therapy is a process where the counsellor is helping you and guiding you through a process where you develop and progress. And they can give you tools to help you do that. And they can listen and help you process your feelings and emotions. But the emphasis on moving forward and developing and progressing is on yourself. You really need to do the work yourself. Nobody can do the work for you. Nobody's going to come along and wave a magic wand, as nice as that would be. Hard work and effort and consistency is required to progress and move forward. And it's only when someone is at a stage that when they feel ready for therapy, that therapy can be beneficial. Sometimes people are aware that they need therapy, but they're not quite ready to take that step for therapy. And that's okay. That's fine. Until they're ready, it's only when they're ready to be prepared to put in the work is when they need to go. They are ready to go and have therapy. Towards the end of going through the contract and the boundaries with my client, I will also reassure them, and I will encourage them to give me feedback, because I'm more than happy to accept feedback on what the client finds helpful or not helpful, because this process helps guide me to see if I'm on track at meeting the client's needs or if I'm way off track. And then obviously I can address that, and I can say, like, you weren't so happy with today's session. What was going on for you? What would you like to do? What would work better for you, for example? Or if someone is happy with the way things are going, you know you're going in the right direction for the client's particular needs. Then towards the session, I'll always ask if they have any questions that they would like answered. And then as after the initial contract's gone through, that will take most of the first session, but then you'll start doing an assessment of the client's needs, and which will probably carry over into the second session. And then once you've done that, you will identify some issues that need to be addressed. And then it is up to the client to decide which of those issues they want to work on and what it is that they feel they need to work on. So whatever they bring to the table. And often in therapy, what clients come with as what they think to be the presenting issue is not the issue that you often end up working with within therapy. So what happens in therapy? Sometimes it's hard to talk to family and friends, and you just need that one person who takes the time to listen. That's a recurring theme with people who've been to therapy, just having that safe space, that time for themselves in the busy, hectic life, just for them to sit and reflect and think about how they're feeling. Because often in life, when we're busy and hectic, People forget to prioritize themselves, they forget about self-care, and they can get lost in the chaos of life. So this safe space is really important for helping people align with who they are and know what they want from life. And deal with past traumas, or help them work out why they're feeling so anxious or why the mood is so low. So what might you cover in therapy sessions varies. For example, your therapist may go through specific examples with you, or may have a general discussion about how you're feeling. They may ask you questions about your current and past relationships, your childhood and past experiences, situations or events you find difficult, how you feel, how you behave, what you think about things, issues that have come up in previous sessions. But it's important to remember that you don't have to talk about anything you're not ready to talk about, or anything you don't want to do. Also, it's important to note therapy does not involve giving advice or directing a client to take a particular course of action. Therapy is about allowing the client the time and space to work things out and work things through for themselves. So then it empowers the client. How will I feel after a therapy session? It is common to feel a range of emotions after a session. For example, you might come out of your session feeling relieved if you've shared something important and felt heard and understood. You might feel energized if you've started to understand something new about yourself or set yourself a new goal to work on. On the other hand, you might feel exhausted if you found the session challenging or hard work. You may feel frustrated if you don't get what you wanted out of your session, or you haven't felt heard or understood. You may feel upset or overwhelmed if the session has brought up very painful or difficult memories or feelings. Sometimes therapy sessions can bring up feelings that are difficult to cope with, and you might feel nervous about going back, or like you want to quit. That's all part of the therapy process. And after your therapy session, it's important to remember to be gentle on yourself and do something to help you relax or that you enjoy before going back to your usual routine, such as going for a walk or listening to some nice music. However, if therapy is bringing up feelings that you can't cope with, and you feel like you're in crisis after a session, please contact a crisis service and seek urgent help appropriately. Dealing with therapy coming to an end. It's common to have a mixture of thoughts and emotions about finishing therapy. It is likely to depend on the experience you've had and the relationship you formed with your therapist. There is no one particular way you're supposed to feel. If you are worried about how you'll cope, tell your therapist how you're feeling, as they will help to better prepare you for the therapy ending. What do you do if therapy isn't helping? Therapeutic relationships can be challenging. It can take time to build trust and feel comfortable with a therapist. And it's common to have times where you feel frustrated or upset after a session. But if you feel that even after trying it for a while, you're really not happy with how it's going, in this case, you may want to consider talking to your therapist about any problems that you're having with them or the relationship. Asking your therapist whether they can offer you a different type of therapy. It may be the therapy that's on offer isn't suited to you. Asking your GP or the NHS service if there is another therapist you could work with, for example. Finding another therapist, especially if you're accessing private therapy privately. And at the last resort, ending your therapy or seeking alternatives to try instead. If you have a serious concern about any treatment you've received, you can complain. Your therapist should tell you their complaints process if you ask them for it. If that doesn't feel possible, you could ask your therapist what professional body they're registered with. Then make your complaint through that body, as all professional bodies should have a complaints procedure you can follow. If you're unsure about how you feel and want another option before making a complaint, you can contact the British Association for Counselling Psychotherapy, or BACP for short, to get help with counselling concerns. This is a confidential telephone and email service for any questions or concerns you have about good and bad practice in therapy. Or you could contact the Clinic for Boundary Studies, which provides support services for people who feel they have been harmed by someone in a position of trust. Now I just want to take a few moments to look at some testimonials from clients who've been through the therapy service with Thrive. Client A was a client I worked with, a male. He presented with social anxiety, and this is a testimonial that he's written. It talks a little bit about the work that we've done together in here, and I thought might be helpful for those of you who may feel stuck or may feel like nothing's going to help. So he said, when talking with Marnie, I feel more and more empowered, as she has a real knack of helping me to realise my anxiety is controllable. And I just need to remind myself aware of where I have been, how far I have come, and I know I can go far as I know I can go as far as I need in the effort of becoming the confident man I used to be and can be again. That was really heartwarming when I read that. It's nice to get the positive feedback when you've helped people. And then he went on to say, absolutely fantastic, and thank you again. And that also comes from my family, as my issue also became theirs, with the thoughts of would I ever be ready for this wedding? Revisiting all the skills I've learned during my sessions, I embark on a cruise, and that has been a real concern of mine. But having worked with Marnie, I feel confident I have the skills to deal with any unexpected situations that may arise. And whilst revisiting the skills, it helped me to realise just how much I have come on since these sessions started. So this client made a massive difference in his life and had a good positive impact on him getting back to the man he remembered himself being. Client B. This client presented with severe anxiety attacks daily, so they were very frequent, a female professional. This is her testimony from when she finished therapy. I feel that therapy has given me a real sense of perspective on why I was feeling so anxious. Knowing that Knowing that I would need to discuss the things I had been doing between sessions gave me motivation to put real effort into my challenging behaviour. So that's where the importance of homework comes in. The thought challenging has been the most useful thing, and learning which things are and are not in my control. Looking at things with a more performance than outcome basis has also relieved a lot of pressure and anxiety, and has enabled me to be more confident in delegating. And this client had used the app, but found that using the app, the CBT within the app, it wasn't, she couldn't relate to it. It was just going over her head. So she needed to have the discussion, the one-on-one, to help her I was giving her worked examples of how that sort of related to her in her world, in her life. And then she got it. And then she went on to say, I generally feel much more positive and less anxious on a day-to-day basis, which is a very big change compared to my anxiety levels when I self-referred. I would just like to thank you for all of your help. It has made going through the exercises and learning the new skills so much more effective. Having someone to challenge the negative and unhelpful thoughts I was having gave me a good insight into the fact that the coping mechanisms I've had in place since childhood were no longer working, and that if I put the effort in, that I would get the results, and which I absolutely have. Often you find when people seek therapy as adults, the coping strategies that they learned as children or growing up no longer serves them well as an adult, and it ends up hindering their performance as an adult within the workplace, within relationships. So that's another good reason to help work through those. Client C, a male, presented with low mood and self-harm. His testimony was, at the time when I first started therapy, I was in a really bad place mentally, and this service has helped me so much. So much so, I continue to recommend it to colleagues going through similar things. The iceberg effect really allowed my looking at things in my life in a more positive way. That's just some of the tools that I used with it. Client D, agoraphobia and anxiety. Well, anxiety is a form of agoraphobia. A female. I have been able to leave the house alone and enjoy my life. I now know ways of coping with my anxiety. For example, deep breathing exercises, and feel confident using these techniques if things feel too much. My therapist has been really helpful and informative throughout the experience. My therapist was friendly, understanding, helpful, and approachable. Thank you for your help and support. So the lady who had agoraphobia hadn't been out the house in a long time, and she had, and when she did venture out, which was rarely, she would always have somebody with her, a partner. So it severely restricted her quality of life and what she could and couldn't do. So it was great to see her progress in a relatively short period of time as well. Client E, this is the last testimonial, presented with severe low mood, a male. His testimonial was, therapy helped him realize how much mindfulness is important to his own mental health and the importance of speaking about how he feels. Marnie has had a massive impact on not just my mental health, but my family dynamics. I don't know if she realizes how much. I am so glad to have had the chance to engage with Marnie, as she has made my family a happy place again. And obviously, as you can imagine, that melted my heart. It's such a lovely testimonial, and it's lovely to have such a positive impact on people's lives, not only the person I'm working with, but the family interaction that they have because of their mental health improving. So signposting to professionals. As you can see, there are plenty of organisations where support is available, dependent on individual circumstances, such as the Samaritans, Relate, Turning Point, The Mix, Give Us a Shout. And if it's an emergency, always remember to call 999 if there is a danger to life. The first point of contact, if it's not an emergency, is the GP. Here are some regulatory bodies and directories that I thought you might find useful, such as the British Psychological Society, where you can find resources and a list of chartered psychologists. The British Association of Counsellors, which provides information and a list of accredited therapists, among others there, which you may find useful. So, just to recap, today we have discussed what therapy is and when do we need it. We have touched upon different types of therapy and considered how to prepare for therapy, what happens in therapy, and how you may feel after therapy. And also what to do if therapy is not helping. Finally, I shared some testimonials with you from my clients who received therapy via the Thrive app. And then I suggested some further resources. So today's key takeaway is to start being proactive in your mental health and well-being, rather than being reactive. The sooner you seek help, the sooner you can improve, and the less likely you are to continue on a downward spiral. And always remember, it's good to talk. A problem shared is a problem halved. The Thrive app is easy to download. You can scan this QR code with your smartphone and then enter your unique access code for your company. In the app, you can find, for example, 25 cognitive behavioral therapy exercises, calm breathing, goal setting, meditation, and relaxation exercises. Also, it is via the app you can access the therapy service. And just as a reminder, Zoe is here today from our relationship management team to talk to you about how you can access the Thrive therapy service via the app after we've taken some time for questions. So I'd just like to thank you for listening today. I hope you enjoyed today's webinar. And if anyone has any questions or reflections, if you just please like to share them in the chat function, or you're more than welcome to click unmute. Someone's asked a question, how to obtain other therapy offered than CBT with the NHS. It's always the first point of call. Also, how can you really choose the therapist via the NHS? Again, I think that's about going back to your GP and letting them know that CBT doesn't work for you and you would like to try an alternative therapist. And say that you've already tried CBT. You can choose, you can ask for a specific therapist that works from a specific therapeutic standpoint. And then someone's put, I just tried loading the link from the QR code and the page doesn't seem to be working. If anyone's having any issues with that, they could, or if there's any questions that aren't answered in today's chat, you could email me on Marnie, that's MARNIE, @thrive.uk.com, and then I'll see if I can help you with your question. Someone's asked a question, how many sessions would be standard? That's a very difficult question to answer. I know within CBT, within the NHS, you would expect something like 6 to 12 sessions. I think it's nearer the 6. I'm sure it's about 8 within the NHS for CBT. But dependent on the presenting issue that you're going in with, dependent on the service that you're going to, and dependent on the therapeutic framework which the council is operating from, that would be varied. But like I stated earlier, that should be made clear in the therapeutic contract at the very beginning, at the first session. And if it's not, you're more than welcome to ask. That's part of being boundaried within the therapeutic relationship. And there's a comment saying, thank you, that was interesting. Then someone's put, is there a waiting list for therapy nowadays due to COVID? I think all the mental health services are bursting at the seams. Thrive as a company are trying to have a minimal waiting list, and it is a lot smaller than other waiting lists. And you're looking at maybe waiting a couple of months rather than several months, if that's helpful. And also on the waiting list, that we do offer a service where we do fortnightly webinars to try and help people while they are on the waiting list for different issues. Myself, I do those, and Penny, another therapist at Thrive. There's a question, where would you recommend to go for advice and support online? I think if I understand your question correctly, the list of resources that I put on had some like Shout and the Samaritans, for example, are online services that you can access via chat, telephone, email. And then someone's put, my issues and concerns don't feel big enough for therapy, but sometimes I'd appreciate talking to someone independent who is removed from the situation. Would it be appropriate for me? And my answer to you is yes, absolutely. As you saw from the slides, the theme I was trying to get out there is about being proactive in your mental health and well-being rather than being reactive. And it's situations like that where things are just niggling away and you're not quite sure, do I need therapy, do I not? There's no harm in seeking therapy and working things through. And if you find you don't need it, then you don't need it. It's not a problem. How can you find a credible therapist, as there is a long waiting list for counsellors via IAPT and the GP? As I've shared on the resources, there's the counselling directory and the British Psychological Society and the BACP. They all have lists of credible therapists, and the Healthcare Practitioner Council also. Can you recommend any face-to-face therapists? I personally can't, no, but it is good if you can have a therapist who's been recommended to you. But I guess if you, like I've said, if you start a relationship up with a therapist and you find it's working, then great, continue. If not, then you can ask to have another therapist. And it is always good to look on an accredited list when you're looking for a counsellor or therapist. That questions came back earlier where asked many times to my GP, but I've only been referred to CBT. I think if that was me in that instance, I would ask to see another GP or ask for a second opinion from somebody else. You really do have to push and be proactive in this process as well with your GP. I'm sorry that I can't be any more helpful than that. It's about you sort of keep presenting with that and pushing for it, really. How much would it cost privately? Private sessions vary depending on the therapist, where they're located, their experience, and all these sorts of things. I think on average, that's averaging it out between £60 and £100. That's average, but again, it will depend on where you live as well. Someone's put, do you know the council's access code? No, but if you can email me, and like I said before, marnie@thrive.uk.com, I'll try and find that out for you if you can give me some more information. If thinking about what's happening and has happened in my life is too difficult and just makes me feel worse, how can therapy help me? Avoiding the issues just seems like a better way of coping, even though not really. Yeah, I totally appreciate what you're saying there. And a lot of clients that I have worked with have buried their head in the sand for a period of time. And you can get away with that for so long. But if you've got like upset emotions, unresolved trauma and the like, or things like that going on inside, you can only keep a lid on it for so long, and it comes back and bites you on the bum, and it sort of will bubble up at some point. That's why it's really important to be proactive before you reach a crisis point and seek help as early as possible. So even though you're saying it makes you feel worse, I think in therapy that's part of the process to process those uncomfortable emotions and work through them so that they no longer trigger that intense emotional reaction within you. I'm just mindful of the time, and there are a lot more questions, but sorry about not being able to get through them, because I need to hand you over to Zoe, who is now going to demonstrate how you can access the app, how you can access therapy via the app.
Thanks very much, Marnie. Are you happy to do the slides for me?
I'm just making her a host now. There we go, Zoe.
Thanks, Marnie. That's great. Are you happy to?
Can't hear you.
I don't know why. Can you hear me now?
Do you need to alter your
Can you hear
audio
me?
settings? If you go on, you know where the microphone is, and click on the arrow pointing down. Is everything as it should be? Zoom sometimes does this. Does anyone have any suggestions? Having technical issues? Oh, other people can hear you, Zoe. It's just not me. So go ahead. Everyone else can hear you, just not me.
Okay, lovely. I need you to skip the slides, Marnie. This is the problem. You can't hear me.
Zoe, go ahead. Everyone can hear you.
Okay, great. Thanks, Marnie. That was really interesting. Sorry about that, everyone. I wasn't sure if Marnie could hear me, as you can see. So we have only got a couple of minutes left. So whilst we were here today to talk about the therapy service available through the Thrive Mental Wellbeing app, I thought it might be helpful for me just to give you a quick introduction to Thrive and our app, so you can understand how it all fits together. So Thrive is an innovative full-service mental health provider. We partner with organisations that seek to provide access to quality mental health support for individuals to overcome any challenges that they may be experiencing. The objective of our service is to identify individuals that are unwell, to empower them to seek help and recover as quickly as possible, and provide evidence-based techniques that can help prevent mental health conditions from arising in the first place. No more waiting times, no cost shouldered by the end user, no need to take time off work. All support is accessed confidentially and securely via our award-winning evidence-based app. The app contains over 100 hours of content, which sits over various different programs and techniques and educational videos that can help with understanding and managing mental health conditions, from our cognitive behavioural therapy program to meditation, deep muscle relaxation and breathing techniques. Everything in the Thrive app is designed to help users recover and stay well. For more information about Thrive, you can visit our website at thrive.uk.com or use the QR code that I'll share at the end of this session. Thank you, Marnie.
Chloe, is that the right slide?
Okay, great. So as I mentioned, identifying individuals that are unwell. Now we do this via screening tools within the app. We use the PHQ-9 and GAD-7 tools to identify and assess the degree and severity of depression and anxiety shown by our users. Identifying these symptoms and their severity means that we can signpost individuals to get the right help. Now, one of the reasons that Thrive was developed was to offer mental health support at scale. Our co-founders, Andreas and Adam, have worked within the NHS for many, many years and have provided mental health support to hundreds of individuals during that time. And unfortunately, due to long waiting lists, they were often not seeing patients until they had reached crisis. And the reality is that if these patients had been seen or had access to support maybe 6 months earlier, the likelihood is that they wouldn't have ended up at that point of crisis that they were in. Now, our therapists will reach out to or reply to individuals within 10 minutes. So by accessing therapy via the Thrive app, we're talking about the potential of 10 minutes versus 12 months. Now, Thrive's in-app therapy service provides all users with access to Thrive's team of trained therapists for confidential support at the touch of a button. The service ensures that our users get the help they need when they need it as quickly as possible. By proactively reaching out when a user is experiencing a tough time or difficulties, we empower them to get the support they need, recover as quickly as possible, and avoid more serious problems, improving the lives of people and helping to prevent sickness and absence. Now, our in-app therapy service provides a safe and confidential space for our users to talk about the challenges they face to their mental health. And our qualified therapists can deliver psychoeducation via webinars, coaching in accessing and utilising the exercises in the app as a self-management tool, so those breathing techniques, meditation sessions, and other mindfulness techniques, and as well as providing that short to mid-term online counselling sessions that Marnie has spoken about. We can help reduce the amount of people who don't seek support. Our proactive therapy service reaches out to users who screen positive via the app for anxiety, and or depression. We help prevent mental health conditions from worsening, and we support our users to recover as quickly as possible, whilst limiting the impact on businesses due to poor mental health. The Thrive app removes those barriers to access by providing as many therapy sessions as possible or as needed via a solution that accounts for those people who favour engaging with digital text-based services, whilst flexibly providing the option for video and telephone calls if preferred. Our therapists aren't just there to support individuals with their own mental health. They're on hand to help individuals support friends, family members and colleagues, as well as offering help and guidance to people managers, mental health first aiders and wellbeing champions. So that brings me to the end of my little talk about our in-app therapy. But if you did want any more information, you can hopefully scan this QR code here to find out more and request a bit of a live demo with one of our team. And if you do have any questions, I know Marnie's provided her email address, but if you're having any trouble logging onto the app, you can email help@thrive.uk.com. That'll come through to our client services team, so we can help get you logged onto the app. And if there's any more questions or if anyone is hanging around, me and Marnie are here to answer them.
Yeah, I can hear you now, Zoe, as well.
Oh, fantastic.
Someone's asked if they'd be able to have a copy of the slides from today's session. Yes, of course. If you can email me at Marnie, MARNIE @thrive.uk.com. Someone's commented saying, thank you for emphasising the proactivity message. I know my own reactions in the past have been there are so many people who need it more than me, but with the long waiting times that I've tried to push through things myself rather than seeking help. And that's often a case, isn't it? People often think other people need it more than them, but if you feel you need it, you seek it for you. And yes, the long waiting times within the NHS are proven to be problematic for people. That's why there's so many services out there also offer psychological support, like some of the ones I've listed, like the Samaritan, Shout, and so on, and obviously the Thrive service. Has anyone else got any more questions?
I've just seen a question about the Thrive app and if it unlocks as you go through the levels. So essentially the Thrive app, it does appear to be locked when you first enter it. That's really just to make sure that you're not overwhelmed with all of the content. You can just go ahead and if you click on one of the sessions, it will ask if you want to unlock it. But if you did want to just go with the user journey, it will unlock as you work your way through the kind of the CBT program, and then you'll be introduced to some of those techniques depending on you know, how you respond.
Yeah, but you can cheat, can't you?
Can cheat, yeah, you can just unlock the sessions.
Yeah.
And yeah, the login is based on your organization. So you should have an access code that's exclusive to your organization if you reach out to maybe a line manager or someone in wellbeing, or you can just drop us an email at help@thrive.uk.com.
Have you seen that one where it says, does the app unlock as you go through the levels, or has our company bought a limited version?
Yeah, I think we just answered that one, how you work through it. You can just you can go ahead and unlock the sessions, and they just appear to be locked just to take you on a bit of a user journey. But like I said, you can just go ahead and unlock them and use the techniques. I think that's...
Someone's put, is it all just for employees? What about friends or family of the employee?
So that really depends on your employer and the agreement they have with Thrive. So again, you can reach out to us at that email address, help@thrive.uk.com. Some employers have family and friends access. There's no reason why you can't you know, share some of the techniques with family and friends. I'm a big believer in mindfulness and how powerful it is.
And then someone's asked, did you say our login will be based on our organisation? So I don't need to sign up?
Yes, so again, your organisation would have an exclusive access code to Thrive. So if you do need that, you can email us at help@thrive.uk.com, or contact someone in your HR or wellbeing team to get that access code.
And there's people saying thank you very much. It was very interesting.
Great stuff. Well, thanks everyone for joining.